Hello, my name is Ayesha Delany Brumsey, and I'm the Director of the Behavioral Health Division at the Council of State Governments Justice Center. We're a national nonprofit that helps communities across the country improve their justice systems. I'm glad to be with you all here today. Most of you are likely familiar with the phrase competent to stand trial, and you're all likely aware that this means that if you're accused of a crime, before you can proceed through the court process, you must be able to help your lawyer defend you. When a judge, prosecutor, or defense attorney is worried that someone does not understand the charges she is facing, perhaps because she has a serious behavioral health condition that affects her comprehension, the judge may order her to have a competency evaluation. If she's not competent, then she can be ordered to receive competency services, the purpose of which are to address her most serious symptoms and provide legal education to prepare her for court. This all may sound simple, but in reality, the competency process can be complicated and lengthy. People can get stuck going between court, evaluation, restoration, and return to jail where their mental health gets worse and then back again. All of this can seem arbitrary and confusing to the individual loved ones, and particularly in this time when we're facing the COVID pandemic and jails and prisons are some of our largest clusters of the disease, keeping people incarcerated in those facilities represents a crisis that we must address. Take Derek Clay. In 2017, Derek was a 26-year-old who had been diagnosed with a psychotic disorder. He walked into a restaurant and took a burger and fries worth $11 without paying. When a bystander called 911, the police and ambulance arrived to take him to the ER. As they were trying to take his blood pressure, Derek panicked and punched a paramedic. He ended up in court charged with the misdemeanor. When the judge ordered a competency evaluation, he was found to be incompetent. Derek spent nearly 2 months in jail waiting for a bed in a psychiatric hospital so he could be restored. All of this due to the theft of a burger and fries when most likely all anyone wanted was for him to get the mental health care he needed. These stories are all too common and some even more tragic. Jillian White, age 64, committed suicide while waiting 60 days in the Pitkin County Jail for a hospital bed so that she could be restored. These lives are just a few examples of the ways our strained system affect many people across the country. Indeed, from 1994 to 2014, state hospitals saw an average 72% increase in the number of people receiving competency services. This, combined with a nationwide shortage of hospital beds, is one reason why people wait so long in jail for restoration. In addition to the human toll, these delays cost states millions in fines when it is found that they are not meeting the constitutional requirement that you cannot deprive someone of their liberty indefinitely. Fortunately, states are rethinking their approach to competency. They are motivated in part by the recognition that it's an expensive process that is too often neither improves individual health nor makes the legal process more fair. Indeed, competency services are not designed to address mental health needs above and beyond what is needed to ensure that the person is fit to proceed through the legal process. As one judge in Oregon said, it cost us more than $300,000 to try to restore to competency a young woman on my docket. And yet, when her charges are dismissed, she has no housing and no community support or services. The community and this woman would have been better off if we had diverted her out of the criminal justice system at the beginning and invested the money spent on restoration on services and housing that would support her for the long run. Indeed, as just one example of the impact on state budgets, Florida state leadership found that they were spending 25% of their entire mental health budget on the forensic state mental health beds that were reserved for competency restoration and related supports. Policymakers seeking to address this challenge can feel stuck as they work to disentangle the complex and intertwined challenges across both the criminal justice and health systems. To help chart a path forward, the CSG Justice Center and our partner organizations convened a group of national experts to articulate a vision for an ideal competency system. According to this vision, states are encouraged to take steps to limit the use of competency to instances where they have a strong interest in pursuing the court case. Generally, this is when an individual is facing serious charges. For cases where it is not possible to limit or avoid the competency process, it should be handled quickly, efficiently, and carried out in the least restrictive setting possible, such as an outpatient community-based health clinic. To achieve this vision, our advisors articulated 10 strategies, drawing on the experience of state and local jurisdictions across the country. The first set of strategies speaks to the need to bring everyone to the table, judges, prosecutors, hospital executives, and patients themselves, as well as many others, to review data on their local system and identify where they can make improvements. For example, Texas convened a leadership group including all 3 branches of state government to pursue legislative reforms and changes to court rules to improve the competency process. The next set of strategies outline exactly how jurisdictions can limit competency. This includes building robust community-based treatment and supports, such as housing, that prevent people from even coming into contact with the legal system in the first place. And for people who do come into contact, states can implement diversion programs that, whenever possible, provide off-ramps out of the justice system and into treatment and supports. Another tool is to set statutory limits on the use of competency. For example, in Hawaii, just this year, legislators passed a law stating that for people who are charged with petty misdemeanors, such as theft of a burger and fries, if they are found to be incompetent, instead of proceeding to restoration, the case is simply dismissed. The final set of strategies seeks to help states improve the efficiency, quality, and equity of the competency process. This includes, for example, setting time limits for critical steps in the process, such as agreeing that the time between a request for an evaluation and when the evaluation is scheduled should be no longer than 3 days. One approach that some states have taken to improve the efficiency and quality of the competency process is to increase their use of outpatient evaluation and restoration services. Indeed, Tennessee's primary approach for handling restoration services is outpatient. Research suggests that this is both effective for restoring people to competency and also leads to substantial cost savings for the state. Through this effort, we sought to compile these strategies in the hope that states will have the tools, informed by examples from their fellow states, to improve their systems of care and justice in a way that supports the health and well-being of their citizens and promotes fairness and equity across the system. And there's no time like now, when we're in the pandemic and facing the crises that we are facing now, where this need is more urgent to address. Thank you for your time. I'm happy to answer any questions that you have today. And please feel free to reach out if you have any questions in the future.